There's different fillers on the market, and every filler has a different property. I don't like to use one filler for everything that I do. I like to use the correct filler for the right job. So this is a nice soft filler that gives a nice lift. I'm Dr. Dhir, a facial plastic surgeon in Beverly Hills. I want to show you my patients are real people who want natural results.
Hi, I'm Connie. I have these under eye circles that have magically appeared ever since I've had my boys. They're 3 and 5. I don't think I look bad, but these under eye bags and dark circles, they're starting to bother me. I feel like my mom's mom. I would like to be able to run errands without having to put on layers of makeup and hide these bags of accomplishment, if people want to call it that, because I've had these beautiful boys. Maybe after this, it'll give me more self-confidence, and in turn, I'll be able to do more things with my kids and not feel so decrepit. I want to look natural. Naturally happy and healthy and glowing again, like I did in my youth.
Hello, Connie. Welcome to the office.
Hi.
Dr. Dhir.
Nice to meet you.
How does staff treat you?
Great.
So far, so good?
Yes.
Perfect. So I understand you have 2 children.
Yes.
You've done with breastfeeding and everything like that.
Definitely
Definitely
done.
Okay, and they're in preschool now?
One's in preschool and the other one is about to go into kindergarten.
Kindergarten, okay. So you're at that perfect age where suddenly you are done with the kids at the home life, but this is the time we start to look in the mirror at yourself and start to worry about yourself and kind of coming back and not even notice what's been happening, the carnage, as you said, that's been happening for all these years.
Or wondering what happened.
What happened? So there's actually 4 things that happen as we get volume loss and gravity. Number 1 is the hollow underneath the eyes. 2, smile line. 3, frown line mild on you. And 4, the neck skin starts to get a little loose around the neckline. Again, that's very mild on you. Specifically, you brought up that you start to have this dark circle. Patients come to me with very similar problems. Yours is mild to moderate, but patients sometimes have more. But the point is, the complaint is always the same to me. I feel like I'm tired. I feel I haven't got enough sleep, even though I feel like I did. I feel like don't look rested. Patients say, when did this happen? I've had kids for 3 and 5-year-olds, and when did this happen? You're finally looking in the mirror again and worrying about yourself. So this is a really, really common concern. So today our options are, how do we return volume to this region and also get some lift in the face from the gravity portion?
It looks like the gravity has taken over.
Gravity takes over once we lose volume, and so we want to address those 2 concerns. Today specifically, we're going to talk about using fillers, okay? There are some other options, but fillers are truly a great option to discuss because they're instantaneous. Number 2, they're reversible if for any reason there was a complication or you didn't like it, which is very rare. And number 3, it's not permanent, okay? So we're going to be using Restylane under the eyes today, and we're also going to try to get this cheekbone in line with what we have here. We have a really well-developed cheekbone here, or cheek tissue volume here, but our cheekbone here kind of drops in, and that causes, when you lose volume, a little bit of gravity, which you kept kind of mentioning that the gravity is taking over. So we want to fight gravity by adding volume back in this region to continue from this beautiful cheek mound, because it kind of loses right here. We're just going to add a little voluma, and that will lift this part of the neck so that it's a well-defined jawline. It'll give you some facial contour so that even without makeup, you're still going to feel that you have the contouring of having a refreshed face. This is a great time for you to start because we can be very natural today. We don't have to be very drastic to change you from your face that you have. I know you have a family. You want to make sure you continue to look natural to them. And so this is a great place, a great time to start in life, and especially you deserve it. You've been with children for almost 5 years in a row now. It's time for you to worry about yourself. So I think this is a good way of kind of treating yourself and spoiling yourself.
All right.
So let's do that today.
All right. Thank you.
All right, so let's get started. All right, to start, we have her all numb. This orange here is the iodine or betadine swabs. This is because I like to keep it like a sterile procedure, like a surgical procedure. We're only gonna be entering the skin at minimal amounts, 1, 2, maybe 3, 4, and 5. You will feel pressure.
Yes, I feel pressure.
But you will not feel pain.
No pain.
Okay. What we do is we just enter through my area where I put the injection to give it some Novocaine, so she should feel no pain there as well. And what we do is we use a blunt tip needle. It's a cannula. It has no sharp end. This actually decreases chance of damaging any kind of small arteries, so you don't want to get any bruising. So far, I've only treated the tear trough, which is this region here. I went under here to try to thicken that skin a little bit, which has a dark circle and that pigment to try to make it a little thicker. By adding volume around here and a little bit in this region, I was able to get a little bit of a lift of this front part of the face, plus fill in the tear trough or lower eyelid region. But now we have this mound here of cheek, and it's come down, it's descended with gravity, very mild on her, but what I want to do is continue it out here, this mound here, so her cheekbone is all uniform and smooth and contoured. We've done the Restylane under the eyes, we've done the Voluma in the cheekbone region, and what we've seen now, if you look at the other side, you have a little bit of more descent or some fullness in the cheek region here. As you can tell from here, it's been lifted, and you can actually see a nice, beautiful jawline take shape. You also have a cheekbone that's now well contoured and harmonized with the middle part of her cheek, and her eye circle or dark circle has been markedly improved. And with all of that, you get a little bit of a lift in the face. So take a look. You can see the difference.
I love it.
So one of the great things about fillers is that they're instant. You see them instantly. You've done a great job. We have no bruising from using the technique of using a needle, a blunt tip needle. And what we did is we did the whole cheek region. You've done so well so far. So I'm going to continue on to the other side.
I can't wait to see the other side.
And as you can see, I'm getting a really, really good treatment of your dark circle. I'm just working on symmetry now. And then when I do the cheek, it will be pretty much done. All right, Connie, I'm really proud of this result. I'm going to show you in a sec. When you see your face, though, these little white marks here that are showing, these are from my Novocaine injection. So that's actually what makes it less likely to get a better bruise. Sure. These little marks right here are my needle entry points where I treated the tear trough. We have a cheekbone now that was once hanging down here. We elevated it. So now we have a heart-shaped face with a really well-defined jawline on both sides of her face, which she felt it made her face look thinner. And the reason that happens is that she actually got this portion of her face to come in by lifting it, and that gives us a little bit more contour in the face and does make us look thinner. Go ahead and take a look in the mirror. You can see that the dark circles have been treated.
Oh my gosh, no more dark circles. And I look like I'm 20 pounds lighter.
Your smile is going to be a little bit off because of the numbing medicine, so you'll get that smile back in about an hour. But as you can see, contoured face.
I love it.
And you can see your dark circles. Take a look at your eyes a little bit closer. I want to make sure that we treat your dark circles to what you notice it and what you wanted.
Yes, I love it.
All right,
it's great.
All right. Well, my staff's going to call you tomorrow,
Yes.
check up on you, and then I'm going to see you in about 10 days, 14 days, so I can take a look at the result. This time I do any touch-ups if necessary, but I don't think we're going to have an issue.
All right.
Good to
Thank
see
you
you.
so much.
So great. You look lovely.
Thank you. It's been a few weeks since I saw Dr. Dhir. At first, there was some bruising, understandable after a procedure, and I was a little self-conscious about it, but once all that went away, I was ecstatic because I looked refreshed. The happiness just illuminated everything on me, you know, from my skin, on my cheeks, gave me a brighter glow when I put on the blush and the bronzer, down to what I wore with my outfits, because I felt like I wanted to showcase the work that Dr. Dhir did. I am more than happy, and I definitely recommend Dr. Dhir to anybody that wants anything done to their face, because I came in for one thing and he noticed that he could tweak a little something else, and it all came together.
All right, Connie. It's been 1 month since our treatment. How you feeling?
I'm feeling great. I feel so alive and fresh, and I've noticed a lot more people have been looking my way and been more helpful, and maybe it's just the self-confidence that I have now.
I'm really happy to hear that. We focus really just to treat those dark under eye circles that you came in for, and I told you that the reason that happens is that you start to lose volume under the eyes. We all kind of lose it in this region here.
Yes.
And we also lose in the cheek region. And so in non-surgical procedures, we just put volume back where it belongs. And I also want to get that cheekbone back up because it does help suspend the face up. You're right, people are looking because they see a rejuvenated look. It's youthful. You probably exude a little bit of confidence because you
Yes.
feel better. So let's enjoy.
All right, thank you.
So great to see you. Thanks for coming back.
All right.
You guys just met Connie. We treated her under eye circles as well as did a little bit of cheek augmentation. I am so happy that you got to see her reaction. I think this is a perfect example why it's important to go to a board certified physician who has good experience with injectables. The reason is that she came in complaining of dark circles under her eyes, but when I saw her, I noticed that she not only had just a mild dark circle, but she had a little bit of volume loss around the cheek region as well. And that probably was more of the issue, and she just didn't realize it. When a patient's happy, confident, and tells me that they feel good when they go outside, that is truly the best feeling I have as a facial plastic surgeon. Thank you so much for watching this episode of Plastic. Follow me on Instagram at Dear Plastic Surgery, and I'll see you next time.